this because the point of recording it now is so that Marcia can post it on Blackboard, and she doesn't have to take an hour out of her class time to have me come and do this. So the first thing we're going to talk about is the concept of critical thinking. And you've heard that as a buzzword kind of, probably throughout your college career. And really simply put, it's the ability to translate that core knowledge that you already have to move that into a situation that might not be something that you're really familiar with. Because, again, we can't teach you every disease process that might come up on your clinical experience, in your practice, or on the NCLEX. We can't teach you every single medication that is out there. But I can give you some strategies on how to approach, what you do know and how to put that into the situations that you don't know. Give you a fighting chance on these NCLEX questions. Because the NCLEX is very, very different from what it was when Marcia, well, probably not Marcia, but some of us older nurses took it back before computerized testing, where we spent 2 days at the Hartford Armory with no air conditioning in the middle of July, coloring the bubbles with the number 2 pencils for 2 solid days. And they tested us on everything that we could possibly know about being a nurse. Now you go and you sit in front of a computer, and it can give you anywhere from 75 to 265 questions. And you have to prove to the computer that you know it. You know your stuff. And the computer can tell as early as 75 questions that you've either proved your level of competence, and the computer is confident that you know your stuff as early as 75 questions. Or, worst case scenario, it can tell by the 75th question that you don't know anything. And either way, it will shut off at 75 questions. And the majority of the time when it shuts off at 75 questions, you have passed, but it's not a guarantee. There are some that have managed to prove to the computer that they don't know squat, and it shuts off. Or you could go all the way up to 265, or anywhere in between. But what you're doing is you're proving to the computer that you know what you're doing. You know your stuff. So you won't be tested on every single thing that you've learned in nursing school. But you just have to prove to the computer that you know it, that you can apply what you've learned to these situations. So the more questions you can answer confidently and competently, the sooner that computer will tell that you know your stuff and will shut off, and 2 days later, it'll be congratulations, you're an RN. And somebody groaned about that this morning, 2 days, having to wait 2 days. And I tell them, back in those bad old days when we sat at the Hartford Armory for 2 days, it took them 8 weeks to tell us what our results were. And you got a letter in the mail. And if it was a skinny envelope, it was a good thing, because it was a letter that said, congratulations, you're an RN. If it was a thick envelope, you cried all the way from the mailbox into your house, because that was all the paperwork that you needed to fill out to apply to take the exam again in February, because it was only given twice a year. Yes. Sure. It's kind of both. Yeah, you're proving your competence, and the computer is evaluating how confident it is that you know your stuff. Not necessarily. What the computer does is they start off and they give you, give everybody a level of a question of sort of medium difficulty. It's called computer adaptive testing. And then how you answer that question determines what question is that you're going to get next. So if you answer a moderately difficult question correctly, it'll give you something a little more difficult on a different topic. And it'll continue to give you, various types of questions. You will never see the question again. You can't go back and change your answer after you've submitted it. And what will happen, though, and so people, when you've heard people come back and say, oh, there was like full of psych questions, or there was all maternal, or it was all PD. That was because the computer kept giving them questions on that topic until they finally answered one correctly. So if you're in the middle of taking the NCLEX and you find that you're getting a lot of select all that apply, or a lot of neuro, or a lot of psych, stop and think about the fact that you probably haven't been answering the previous questions correctly, and try to maybe, change your approach. So it will continue. So again, it's computer adaptive. No one, you will never get the same test as the person sitting next to you. It will always keep giving you different questions. So when you come out and talk to people, you will have questions on totally different topics, depending on what the computer determined maybe you were weak in, and it wanted you to prove that you were competent in that area. So critical thinking is really, really important, again, because you want to be able to look at those questions, read them critically, figure out where they're sending you, where that question writer is leading you, what path, you know, the yellow brick road, where it's taking you, and avoid getting diverted with distractors and other things that could cause you to go down the wrong road. Yes? Yep. Not necessarily. Well, a certain percentage of those questions are what they call field test questions, so they don't even count. So essentially, you're being tested on 60 questions, because I think about 10 or 15 of them are field test questions. However, I mean, it's not unusual for people to answer 120 questions and fail. It's not unusual for people to answer 265 and pass. So you absolutely cannot gauge it by the number of questions that you get. You know, so because I have had students call me up and say, I took 265, I know I failed, and then 2 days later they email me, guess what, I passed. You know, and then somebody that had set off at 75 thought, oh boy, I'm a shoo-in, and found out they failed. So you can't judge by the number of questions that you took. So I'm going to teach you a few strategies on how to approach those questions, how, when you get down to those two really good-looking answers, how you figure, because that's usually what the problem is. You know, two of them you can pretty much say, you know, really bad. And then you get down to those two that are really close, and how to critically read them and analyze the question to see if you can give yourself a fighting chance on picking the best answer. Because the majority of the questions that you're going to get, all of the answers are correct, but one of them is better than all the others. And that's what you have to learn how to do. You've probably seen that in a few of the exams that you had in 100. You'll see more of it in 110. By the time you get to 220, it's going to be a mini NCLEX every test that you take in terms of the quality and the difficulty of the questions. So don't read beyond the circumstances. How many of you work as techs or CNAs or medical assistants, so you have some experience in medical, and plus you've had some clinical experience. Do not read into the question based on your own personal experience, what you've seen in clinical, what you've seen other nurses do, because not all nurses go by the book, and NCLEX is always by the book. Don't say what if. When you're reading the question, don't say, well, what if da-da-da-da-da. No. The question is what the question is. I'm seeing some, yeah, I'm preaching to the choir here. So get those words what if out of your vocabulary, because if you read too much into the question, if you assume too much, if you put your own personal life experience or a family member's experience into a question, just because they had treatment for this disease and it happened this way and they had this side effect or complication, doesn't mean that that's the textbook situation, the common situation. So you've got to get a lot of that out of your brain, and it's hard to do. It's very hard to do. So figure out where that question is leading you. Read every word of the question. Read every word of the question, because you've probably seen at the very end of a question it'll say except, and if you kind of breeze over that word, it can really change your mind. So let's do this question. Pick up your clickers. The client with metastatic cancer is receiving a continuous IV infusion of morphine sulfate to alleviate pain. Select the adverse effect or sign of toxicity for which the nurse monitors the client. We have dizziness, nausea, skeletal muscle flaccidity, or sedation. Did everybody get a clicker? Need a clicker? Could someone pass one up, please? Okay, are we going to, oh, there we go. Grab a clicker before you sit, please. Okay, so 12% said either dizziness or nausea, 41% said skeletal muscle flaccidity, and 35% said sedation. Who can tell me what the key words are in this question? Adverse effect or sign of toxicity. So in your experience with any kind of opioid analgesic, things that you learned back in Nursing 100, would you expect dizziness as a possible side effect? Sure. Patients with opioid analgesics will get dizzy. How about nausea? Oh yeah, because sometimes the dizziness makes them nauseous. How about sedation? Definitely. Because a lot of times I've had to shake a patient that I've just given morphine to and say, wake up and breathe for me. But you're not going to expect to see skeletal muscle flaccidity, where the patient's kind of all flopping all over, doesn't have any muscle tone. That's an adverse effect or sign of toxicity, and that's what the question is pushing you towards, that adverse effect sign of toxicity. The others are expected side effects. Look for keywords. They're going to ask you to prioritize things. What are you going to do first? Given this scenario, what are you going to do first? Because that's your life as a nurse. You come out a report, you hear about all your patients, who am I going to see first? What am I most concerned about? So they're going to put things in there like early, late, best, most appropriate, least appropriate. And so maybe all of those things are going to be appropriate to your plan of care, to your situation. But what's the most appropriate, or what's the most specific thing that they're asking you? So in this question, you're caring for the client who just returned from the recovery room after abdominal surgery. Select the early sign of hypovolemic shock for which the nurse monitors the client. Decreased deep tendon reflexes, I'm still having trouble talking tonight, increased pulse rate, increased depth of respiration, or lethargy. Wow, 94% of you said increased pulse rate, 6% said increased depth of respiration. What's the key word in this? Early sign. Because when you get to 220 and you learn all about shock and sepsis, you're going to learn that patients go through 4 phases of shock. And the signs and symptoms that they exhibit are based on how their body initially tries to compensate for a lack of oxygen in their tissues. First thing your body's going to do is kick up the heart rate to try to get more oxygenated blood to the body. The next thing would be the increased depth of respiration, because that's another way your body gets more oxygen to the tissues. The decreased deep tendon reflexes and the lethargy, that's way down in the third and fourth phase of shock, where patients are, have one foot on the banana peel or, one foot in the grave. Guidelines for prioritizing, again, huge on the NCLEX. Prioritizing, delegating, and the ever-popular select all that apply are really popular. So you use your guidelines for prioritizing. ABCs, airway, breathing, circulation. Airway is almost always the first priority. But if it doesn't fit the situation, it may not be the correct answer. So you have to be really careful, because you've had it drummed into you. Airway, airway, airway is the priority. But if you're talking about a patient with a fractured ankle, airway's not the problem. Circulation's going to be the problem. But again, those sick, twisted people who write the questions are going to throw an airway or a breathing option in there because they know that you've been told to pounce on that one as the best response. Yes? Oh, you wanted an example of where it wouldn't be. Okay. So it's almost always the first priority. You can prioritize based on Maslow's hierarchy. Physiological needs, safety, pain, things like that are always going to be a higher priority than psychosocial problems, like disturbed body image and fear and anxiety and things like that. So always look for the physiological intervention or nursing diagnosis to prioritize that way. Or you can use the steps of the nursing process, and we'll talk about that in a second. So we have a client with cancer receiving morphine, 10 milligrams sub-Q every 3 to 4 hours for pain. What's the priority action that you include when preparing the plan of care for the client? Encourage fluid intake, encourage the client to cough and deep breathe, monitor stools, monitor urine output. Okay, 22% said fluid intake, 44% said cough and deep breathe, 28% said stools, 6% said monitor urine output. Now these are all things you're going to be concerned about with the client that's on morphine. They're going to need good fluid intake because they're going to get constipated. So if you've got good fluid intake, you're going to prevent the constipation. You're going to watch their urine output because some patients can have as a side effect urinary retention. But why did the majority of say we're going to encourage them to cough and deep breathe? What does that have to do with morphine? Exactly. In this case, coughing and deep breathing is appropriate and is your priority because morphine is going to cause your patient to have slower respirations. And again, just like that, like I was saying, that patient that's on morphine, you know, many's the time I've had to go, breathe, take a nice deep breath, and watch their O2 sat going from 83 up to 97 just because I kind of, you know, woke them up and got them moving and told them to take a nice deep breath. The nurse is reviewing a plan of care for the pregnant client with sickle cell anemia. Select the nursing diagnosis the nurse would select as the highest priority: ineffective coping, disturbed body image, deficient fluid volume, anxiety. Now you may know nothing about sickle cell anemia, because I know you don't learn about that till next semester. You may have personal knowledge of it, but this could be a totally new diagnosis for you. How would you use a test-taking strategy to pick what's your priority nursing diagnosis? So why did 76% of you pick deficient fluid volume? It's physiological, not psychosocial. So if you know nothing about sickle cell anemia, in this particular scenario, you're going to be able to make a pretty well-educated guess that it's deficient fluid volume because the other three are psychosocial. Now, if they throw in a ringer and they throw in another physiological one, then you may have to do a little bit more critical thinking about what the disease process is all about. You can use the assessment, the first step in the nursing process. Often that's the best option to pick. Gather more data, get more information when they give you the scenario and say, what is your priority, what is the first thing you should do? Get more information. If there's not an option to get more information, gather more data, then usually it's do something, implement. With the possible exception that in an emergency situation, it should be do something versus get more information. And an example for that would be you've got a patient that comes in and they're clearly in respiratory distress, nasal flaring, cyanosis, 32 beats per minute. Are you going to bother to check and see what their pulse ox is? Do you need that data? What are you going to do? You're going to give them some, well, you're going to clear their airway, you're going to give them some oxygen. You're going to do something. And you can give 2 liters of oxygen nasal cannula without a doctor's order on a patient that's coming in with those kinds of signs and symptoms. So again, in that emergency situation, you're going to do something. You're going to intervene. But in most scenarios, most NCLEX questions, get more information. That's going to help you make your decision. So the nurse is teaching the client with coronary artery disease about dietary measures, and during the session, the client expresses frustration about learning about it. Select your initial action. Tell the client the diet must be followed, identify the cause of the client's frustration, continue teaching, notify the physician. Wow, you guys are fast. And 100% of you are going to identify the cause of the client's frustration. You learn very quickly. Because you can't continue teaching if you don't know what the problem is, because you're just going to be, you know, moving your mouth and talking away, and they're not going to pick up on anything. Calling the doctor, they're not going to want to hear that. Analysis. Understanding the principles of the physiologic response. What's going to happen when you give this medication? What result will you see? What side effect or complication will you see? What change in lab values might you see? So being able to get that cause and effect and put it together. Determine the rationale for the interventions that are presented. Because oftentimes if you know what can happen or what can go bad, then you've got a whole list of things that you know you should do or you should expect to see in that particular scenario. They will require you to know common lab values on the NCLEX. You need to know the normal ABG values. You need to know electrolytes. You need to know, WBCs, H&H, all those other good things. So in this particular scenario, this is a medical diagnosis that most of you are probably not familiar with, and that could happen on your NCLEX. You're reviewing the lab results. The infant has hypertrophic pyloric stenosis, and you go, oh my God, I've never heard of that before. You can calm down and figure it out. What laboratory finding would the nurse expect to note? So I'm going to have you answer it, and then we're going to talk our way through it and use some strategies to see if we can get the best answer. So are you going to see a blood pH of 7.3? Are you going to see a bicarb of 22? Are you going to see a pH of 7.5? Or are you going to see a bicarb of 19? And because the clickers are anonymous, you can just pick an answer and nobody has to know. Okay, 25% said the pH of 7.3, 20% said bicarb 22, 45% said pH of 7.5, and the rest said the bicarb of 19. So first of all, what is the normal the normal range for the pH on ABGs? Anybody remember? 7.35 to 7.45. And does anybody remember what the bicarb is? That's one that you're gonna have to know it, but I'm not expecting you to. It's 22 to 26, around there. So let's look at this diagnosis, and if anybody knows what this is, please don't shout it out. What does hypertrophic mean? Increased or swollen. So we're going to use our knowledge of medical terminology, anatomy, and physiology to figure out what might be happening to this baby. So we have an enlarged, swollen pyloric. What do you remember from anatomy about pyloric? It's a sphincter in the stomach. Where is it in the stomach? Before the duodenum. So it's at the bottom, at the outlet of the stomach, going into the duodenum. And what does stenosis mean? Narrowed or stiffened. So we have an enlarged, puffy, narrowed, stiffened sphincter at the base of the stomach. With a baby who's been taking formula or breast milk in for maybe a day or two, or maybe just a day, what do you think is going to happen? Is that formula going to go down? No. The formula's got to come back some way. This baby will have projectile vomiting. And when you see it, you will never forget it because they will literally vomit from here to the window. That's how, it's huge. Now, when you vomit, what comes out of your stomach in addition to the food that you ate? Acid. So you are losing acid. So if you're losing acid, are you going to be in acidosis or alkalosis? Alkalosis. So which of these values indicates alkalosis? pH of 7.5. You're going to have a higher bicarb if you're in alkalosis. So this low end of normal or below normal bicarb, you're not going to see in this patient with metabolic alkalosis. And you're not going to see a blood pH of 7.3 because that's acidosis. So that's how you can take something you know nothing about, and instead of panicking and just not answering or flipping a coin and going on to the next, you can give yourself, in probably about less than a minute, a fighting chance to answer that question based on the knowledge. That's critical thinking. So that diagnosis that comes up that you've never seen before, you can try to figure it out. Yes? You can. But if you skip, it counts as a wrong answer. And you can't. Once you answer a question and you hit submit, it is gone. It is in the ozone. You can never go back and check it or change the answer. No, there's no skip and go back. No, you answer it one way or the other and you move on. Yeah, it does. Planning, prioritizing diagnoses, determining your outcomes. Actual client problems are going to take precedence over potential or risk for diagnoses. So many times they will ask you to prioritize nursing diagnoses. Actual takes precedence over potential or risk for. Physiological takes precedence over psychosocial. So kind of keep that in your head because many of them will give you these kinds of questions. You have a plan of care for the client with a cataract. What's the priority nursing diagnoses? All of these fit. All of these fit the patient. Fear related to loss of eyesight, social isolation, risk for injury, disturbed sensory perception. What's your priority? Okay, 32% said risk for injury, 68% said disturbed sensory perception. How come you didn't all answer risk for injury? Isn't safety first? Isn't that the priority all the time, every time? It's a risk for. Does disturbed sensory perception fit the bill? So that's your priority, disturbed sensory perception. And it is that disturbed sensory perception that puts them at risk for injury. But in NCLEX land, because remember, you're not in Kansas, you're in NCLEX land, disturbed sensory perception is going to be your priority. If it's risk for or potential for, you can't pick it unless nothing else in that question fits the scenario. Implementation. You should be focusing on nursing actions versus medical actions. You are not the doctor. So you have to be careful that they don't put in an option that requires you to be a doctor to do it. You focus as if this is your only client. So think back to nursing school when you only had one client. And answer it from the textbook perfect point of view. That means that everything that you need to do this task, to answer this question, is in the room with you, with the patient. So if you need a ventilator, it's there. If you need gauze and saline, it's there. If you need an EKG machine, it's there. That is, so you can't say, you can't read into the question and say, well, I'm probably not going to have this in the room, so I'm going to send the tech to get this while I do this. No, they're going to expect you to say, I've got everything at my disposal, what do I do first? So the nurse is caring for the client with angina, and they begin to experience chest pain. The nurse administers a sublingual nitro as prescribed, but the pain is unrelieved. So select the action the nurse should take next. Call the family, reposition the client, administer another nitro, call the doctor. So 30% wanted to reposition, 20% said give another nitro, 50% said call the physician. In general, in NCLEX land, unless there's nothing else that you can do, they don't want you turfing off the task to somebody else. They want you to do something. It's a test of nursing practice. So you're not going to call the doctor in this situation. What are some key words in this particular sense? Who knows how nitro is ordered usually? Yes? Right. Usually it's 0.4 milligrams sublingual, PRN chest pain, Q 5 minutes times 3. So if they take a nitro and they don't get relief, 5 minutes later they can take another. If they don't get relief from that, 5 minutes later they can take another. If they don't get relief from that, with my home care patients, I would say call 911, because some of them would be foolish enough to drive to the hospital. If I was in the emergency room, I would, after 3 nitro, I would either have to call the doctor if I didn't have a standing order on what to do next. But most of the time when patients come in with chest pains, you got a standing order to do X, Y, and Z when the patient hasn't had a good effect from their nitro. But what tells you in this question the patient can get another nitro? They begin to experience chest pain and you administer a sublingual nitro. So they can get another. And they can get another before you have to go to that, contact the physician if you don't have any other orders. Compare your actual to your expected outcome. So you've done a lot of nursing care plans since you started in the program. You had a goal, you had an outcome that you anticipated, and sometimes it was met, sometimes it wasn't. What you need to do when you're reading these questions is figure out, given these options, did we meet our outcomes? And if not, what am I going to do to change it. So when you're reading that scenario, you need to know the cause and effect again. You also have to evaluate the client's ability to take care of themselves, to be independent, because we want to promote independence. And you also need to know what the team members' roles and scope of practice are. Delegation is huge on the NCLEX, and we're going to talk about that in a second. So now we're going to determine if the question is a true or a false option question. Now, you've probably had a lot of the true option questions. Those are where the answers to the question have a positive relationship to the data that's in the question. The false option question is that question that makes you twist your brain backwards and flip it around a few times because you have to come up with the wrong answer because that's the right answer. You know, one of those things you've taught the patient about a medication and what statement by the patient indicates the need for further instruction. Oh, they love that phrase. So you have to pick the wrong statement or action by the patient because that's the correct answer to the question. And most of the questions, a lot of the questions that you get on the NCLEX are going to be similar to that. A lot that I took on the Certified Nurse Educator exam were false option questions, and I had to use the strategy I'm going to teach you or I would never have gotten through it. But let's look at a true option. We have a patient with suspected meningitis, scheduled for diagnostic tests. What do you anticipate will be ordered to confirm the diagnosis? Electrolytes, lumbar puncture, electromyography, or WBCs? Come on. Okay. So 86% picked lumbar puncture and 14% picked WBCs. Now this is a very common type of question that you might encounter on some of my exams on the NCLEX. And what they're trying to do is to make you differentiate in your mind what is different about this particular diagnosis that's going to require a specialized test to verify it versus things that pretty much every patient is going to have done on them, regardless of their diagnosis. So serum electrolytes, pretty much everybody is going to have that as part of their admission blood work. WBCs, complete blood count, is always going to be done when a patient comes in. So neither of those are going to confirm that diagnosis. So get that kind of that red flag in your head. Electromyography, that tests peripheral nerve function. So that's not going to really tell us anything about meningitis. Lumbar puncture is, though. They're going to confirm that you have meningitis based on the quality of your CSF. You know, is it cloudy? Is it clear? Does it have this elevated protein, glucose? So that's going to confirm that you have meningitis and what type of meningitis. So look at that when you're doing those types of questions. What is it that's different about this? And what are the other options that could be used as part of a diagnostic profile for any particular condition? Now here's a false option. Cortisone is prescribed for adrenal insufficiency. You provide instructions to the client, and what statement indicates the need for further instruction? I will eat a good breakfast every day. I'll avoid people with colds. I'll limit my sodium intake. I'll stop the medication when I feel better. And all of you picked, I will stop the medication when I feel better. That was kind of a slam dunk. Because that's one of the strategies I'm going to teach you later about medication questions. Anytime the patient says, I'm going to stop it, decrease the dose, do anything like that, that's always the wrong answer. But if this was a more complex false option question, like the ones I had on my CNE exam, each answer was like a paragraph. And by the time you finished reading one paragraph and you got to the next one, you totally forgot what was going on and what was wrong or right about it. So what you do with these false option questions is you read the question completely, not missing any words, and then you look at each option separately and say, is this true or false as it relates to the question? Now, it could be true, taken totally out of context, or false, but is it true or false as it relates to the question? and make a little mark. So I will eat a good breakfast every day. Is that true as it relates to the question? And I think that's probably what all of you did when you were looking at this. I will avoid people with colds. Why do they have to avoid people with colds? Because it's an immune suppressant. I'll limit my sodium intake. Should they do that? Sure, because steroids will make you retain fluid, as will sodium. But will they stop the medication when they feel better? No, they shouldn't. So best case scenario, you should have 3 true and 1 false. So the false one is the answer to the question. Now, if you come to where you got 2 false and 2 true, then you're going to have to start using some other strategies to try to figure out, why that's happening to you. But that is a very good strategy to use for false option questions. Therapeutic communication. Focus on feelings, concerns, anxieties, and fears. They will ask you questions like, the patient says this to you. What is the most appropriate response by the nurse? Therapeutic communication. So the mother says to the nurse, I'm afraid my child will have another seizure. Select the most therapeutic response for the nurse to give to the woman. Can you tell me why you're concerned? Most children will never experience a second seizure. Tell me what frightens you most about the seizures. Tylenol can prevent another seizure. Okay, 18% said, can you tell me why you're concerned? 5% said most children will never experience a second seizure. And 77% says, tell me what frightens you most about the seizures. First of all, number 2 is false, because many children will have, will have another seizure depending on what the underlying cause is. But this seems like a very valid, can you tell me why you're concerned? Gathering more data, asking more questions. Why is that incorrect? It's a yes-no answer, and in NCLEX land, if your response contains the word why, it's wrong. Because the writers say that puts the patient on the defensive and appears to be confrontational on your part. And even though in real life you can ask a why question and not be confrontational, in NCLEX land you can't. So this one is open-ended. It doesn't use the word why, so the patient doesn't feel like they're being judged in any way or being confronted. But many times in these kinds of therapeutic communication questions, the why question, the why option, sounds exactly like you would word it, and it's really comfortable, and it sounds, just syntax is great, and it just, it works. And you say, yeah, I'd say that. And the one that's correct, they will intentionally word it really kind of awkwardly, and you look at it and go, I'd never say that to a patient. That's ridiculous. So you have to be very cautious when you're reading these answers. Don't jump on the one that sounds comfortable. Look for the word why there, and make sure you don't pick it. Eliminate similar options. What about the time that you get one option that, you figure, has nothing to do with the scenario, and the other 3 all look equally good, and none of the methods of prioritizing that I've given you work. You can't figure out what's the best one. Go back and read the question, because sometimes the one that's different from the other 3 is the correct answer. And I had students tell me on the psych exam that they take in Nursing 220, they use that strategy a lot. Eliminated the similar, picked the one that was different. So the nurse is assigned to care for a group of clients, reviews the medical records. Which one will she determine that is at risk for fluid volume excess? GI suctioning, renal failure, diuretics, ileostomy. Okay, so GI suctioning got 11%, diuretics got 16%, and renal failure got 74%. Why did you pick renal failure? What is the problem with the other 3? Right, fluid volume deficit. So even if this wasn't renal failure that you're probably pretty familiar with, even though you haven't actually had the nursing content, you've had a good amount of it in A&P, what if it was some diagnosis you'd never heard of before? You could still use that strategy of, okay, all of these other three are obviously fluid volume deficit, so this one must be the correct answer, even though I don't know anything about it. Eliminate the absolutes. If the response contains an absolute like never, or always, or all, or none, or only, those will tend to make that option incorrect. So you have to be really careful when you're reading those questions. The nurse provides safety instructions for the mother of a child with hemophilia. What directive do you give the mother in the interest of promoting a safe environment? Allow the child to only play indoors. Allow the child to play with toys only if a parent is present. Have the child wear a helmet and elbow pads every day. Remove toys with sharp edges from the toy box. And you all picked the one that didn't have the absolute. And they will not all be this easy. You know, I kind of pared some of these down so they'll fit on the slide. But you have to be really, really careful when you're reading these options to make sure that they don't throw in one of these absolutes. Look for the umbrella. This is kind of a rare type of question, but it can come up. You've got 4 options that all 4 of them fit the scenario, and you can't prioritize which one is the best one, the first one. But there might be one option that kind of is a kind of an umbrella or global option that conveys all of the ideas and the concepts of the other 3. Go with the umbrella. So here's an example of that. You've got a nurse in the ED taking telephone orders. You've got patients coming in with cold exposure. What's your initial action? Call the supervisor to activate the disaster plan. Call the laundry and get warm blankets. Call the ICU and get nurses sent down to the ED. Supply the trauma rooms with saline and sterile water. You're going to do all these things. What's your priority? And the vast majority of you said call the supervisor to activate the disaster plan. Because if you do that, everything else is going to fall into place. Because looking at those other 3, you don't know, well, should I call the laundry first? Should I call the ICU first? Should I get the saline or the sterile water? You really can't. There's no technique to prioritize. But if you call the supervisor to activate the disaster plan, all that stuff is going to happen. That's why we have disaster plans. Use delegation guidelines. This is, again, huge on the NCLEX. An awareness of what your scope of practice is as the RN, what you can delegate to the LPN and what their scope of practice is, what you can delegate to the UAP, the unlicensed assistive personnel, the CNA, the patient care tech. And the rule of thumb that you need to do on all NCLEX questions is, again, take your personal experiences out of the equation. Just because you as a tech or an LPN or a CNA was delegated this task does not mean that it's the correct answer to the question. Your approach should always be, if you have a choice between an RN and an LPN, and they say who are you going to give to the RN, you always pick the most critical, unstable patient. If you're having to choose between the LPN and the CNA, and they want to tell you, okay, who should you give to the CNA? The most stable, non-critical patient, or the task that requires the least amount of education and training. And that's not a slam on anybody that works as a CNA or a tech, because again, you've been trained and have had delegated tasks to you that are perfectly legitimate to delegate, but it doesn't mean it's the correct answer to the question. You always have to look at it isolated from your own experiences. Now, I started off as an LPN. And looking back, I am astounded and shocked at some of the tasks that were delegated to me as an LPN that should not have been delegated to me because they were not within my scope of practice. When you are looking at an NCLEX question, you need to remember that it's a national exam, covers the rules and regulations of all 50 states. So if there are some states that do not allow LPNs to do IVs. So even though you as the LPN have been delegated IVs legitimately in Connecticut or Massachusetts, it's going to be the wrong answer on an NCLEX question because it's a national exam. And because some states don't allow it, then on the exam, nobody is allowing it. Same thing with taking doctor's orders. In some states, LPNs are prohibited from taking orders from doctors at all, and in other states, they're only allowed to take orders in certain circumstances or in certain types of facilities. Because of that, you're never going to delegate to an LPN the calling of the doctor and taking the orders, because in some states that's going to be illegal. So you have to be really careful to think of it in terms specifically in scope of practice, most unstable patient versus least stable patient, and delegate based on that. Okay, so we're planning assignments for an LPN and a CNA on our team. What is the client that you most appropriately assign to the LPN? The client with stable CHF, early stage Alzheimer's, the client with dehydration who's weak and needs assistance with bathing, the client with emphysema receiving oxygen and becomes dyspneic on exertion, the client who's scheduled for an EKG and a chest x-ray. Oh, it's not polling. Let's go back and go back to that. Okay, here we go. I love it when that happens. Okay, so we have 25% want this stable CHF, 19% said dehydration, 38% said emphysema, 19% said the client scheduled for the EKG and the chest radiograph. What we have to do, we have an LPN and a CNA. So we are going to pick the patient that is most unstable, most complicated, higher risk for complications, higher level of assessment, and that sort of thing. So we have the client with stable congestive heart failure and advanced and early stage Alzheimer's, a perfect patient to give to your CNA to go in there and do the bath and the ADLs and make sure that they're safe. Perfect patient. Dehydration, weak, needs assistance with bathing. I mean, there you got your job description for a CNA or a tech. So that, again, is a patient who is not critically ill, not going to have a complication. Client with an EKG and a chest x-ray. You have no other information. You don't know if they're experiencing chest pain or they're just hanging out waiting for their tests and then they're planning on going home. You don't know that from the question. So you have to assume that there's nothing else going on with that patient. So the patient with emphysema who is on oxygen, who gets short of breath on exertion, that's going to go to the person with the higher level of training and expertise, because they're going to need assessment, they're going to need an intervention if they start having difficulty. So even though you as the tech or the CNA have been walking that patient that has emphysema, that's on oxygen, that gets short of breath, and it's been delegated to you and perfectly legitimately, it's still, in this NCLEX question, not the person to give to that CNA. Medication strategies. Focus on the name of the medication. First of all, the client is never going to change or stop the medication. You are never going to recommend an over-the-counter drug, because that's still a doctor's order. And it sounds real easy. Oh yeah, I recommend the patient take a couple of Tylenol. Not if you don't have a doctor's order to tell that patient. You never give the med when the order is difficult to read, unclear, or an abnormal dose. Now, how many of you have been in facilities where they still have handwritten charting? Because I do clinical at Johnson's. We still do paper charting. How many have seen nurses hovering around a chart trying to decide by committee what the doctor meant because they couldn't read the writing? Very unsafe. You know, because the old joke is that the only color that a committee can, agree on is beige. Do you want that kind of a decision made on your medication order? They're going to expect you on NCLEX to know normal dosages of common medications, like a range, so that you can look at that order and say, whoa, way too high. Not going to give that without calling the doctor. So you always question those orders. Don't let your license ride on your assumption that you know what the doctor meant when they wrote that order. Call and clarify. The question is always going to give the trade and the generic name. So one of them may ring a bell with you, particularly those generic names that have similar endings in a classification. If there's a medical diagnosis in the question, try to link that with the drug. If they're talking about a patient with cancer and they name a drug that you haven't seen before, it's 99.9% sure that it's a chemotherapy drug. And then what do I know about chemotherapy drugs? And I can answer the question even if I haven't seen that particular drug. Again, identify the classification. If you know that the prils are ACE inhibitors, if you know that the olols are beta blockers, if you know that the mycins are an antibiotic, then you can look at that name and say, ooh, rings a bell. Haven't seen that particular name, but it must be in that same category, and what do I know about that category? What do I expect is going to happen? What side effects might that patient have with that drug? So they may ask you, what do you anticipate is going to happen as a side effect? Or what complication do you anticipate that patient can have on this particular drug? And then look at, when all else fails, look at the med name. Oftentimes the trade name will have something to do with the, the anatomy and physiology or medical terminology. If you see a drug with the name with press in it, you can probably guess that it's a blood pressure medication. So use all those kinds of hints that help you, determine what that medication name is. So we have Synthroid. Patient has hypothyroid. You're going to learn about that, I think, next semester. Select the time at which the nurse tells the client to take the medication, just after breakfast, with a snack at 3, in the morning on an empty stomach, with food. So 22% said after breakfast, 22% said with food, and 56% said in the morning on an empty stomach. Now, some of you may be familiar with Synthroid, many of you may not. And this will happen on these NCLEX questions. You may not know specifically, or you can't remember because you've studied a million different meds. Okay, do I give this with food? Do I give it on an empty stomach? What technique can you use to strategize that I just taught you? Yeah, 3 are different, 3 are the same, 1 is different. So I would eliminate all the ones that involve food and pick the one in the morning on an empty stomach. So even though I don't know that Synthroid has to be given in the morning on an empty stomach, I can take an educated guess just based on the fact that the other 3 involve food. And it would be hard to prioritize just after breakfast, with, it's just, you can't really prioritize on that one. How many of you love select all that apply questions? Yeah, a couple of people lied this morning and raised their hands. Yeah, right. Okay, and the fun thing about select all that apply is that you can't get partial credit for them. So you have to select all that apply, and if you add 1 or subtract 1, you're in trouble. So I have a strategy that is going to be very, very helpful. And this will not be a clicker question. This is one we're going to do together. What we're going to do is we're going to treat this just like we treated the false option question. Read the question, then look at each answer on its, by itself, and say, is this true or false as it relates to the question? Now you have to, that last phrase is very key, as it relates to the question, because it could be a true statement taken, in a different context. So you have to put it in the context of the question. So we have a patient who's having difficulty with motor aspects of speech, difficulty forming words, has a nasal tone. So he's getting speech therapy. What communication strategies are you going to use to work with this client? Are you going to repeat what the client said to verify the message? True. So you're going to put a true. Are you going to encourage the client to speak quickly? No, not in this case because he's having trouble with the motor aspects of speech. So that's a false. Nod continuously while the client is speaking. You going to do that? No. Number 1, it would drive him nuts, because I know it would drive me nuts. And number 2, what do we have here? We have an absolute. So that is false. Are we going to engage the client in lengthy discussions to strengthen the voice? Not in this case. Now, that could be a speech therapy intervention for a different type of speech issue, but not for this one. Are we going to ask questions requiring a yes or no answer? True. Are we going to use a letter board or picture board? True. So we have our select all that apply. Everything that you mark true is A, E, and F is the answer to our question. So if you can stop the panic when you see that select all that apply question and calm yourself down and use that strategy, it will help. I guarantee it. How many of you have changed answers on an exam? Oh, come on. That's all? Come on now. Okay. How many have changed the answer to the incorrect answer? Yeah. Okay. So this is the scenario that you probably encountered. You know, you had your test, and we'll go back to the days when you were taking the paper pencil test. So you're going through, and you get to this question, and you're agonizing over it. You get it down to those two really good responses, and you're doing all your test-taking strategies, and you finally decide that A is the correct answer. So you color in the bubble on A. And then you finish up the exam, and you see that you have a few more minutes, so you're going to go back and look at the ones that you kind of marked for review. And you go back to that question, and after you spent 2 minutes agonizing and using your test-taking strategies, and you picked A, you are now going back to it in 5 seconds. You're going to say to yourself, oh, it must be B, and you erase the A and you put the B. That's changing the answer with doubt, not with confidence. Because you should have gone with that first one that you really analyzed and critically thought your way through. Now, if later on in that exam something, you know, triggered your memory, you still have to be very careful, because you could go back to that question and say, well, you know, this an answer similar to B was the correct answer for this other question, so it must be the correct answer for this one. Don't fall for that trap either, because the questions could be very subtly different, very slightly different, so make sure that you read it carefully. Again, with confidence that you picked the wrong answer, not with doubt. The other way that you would have confidence that you picked the wrong answer is that you marked it on your exam that B was the correct answer, and like you had a brain fart, and you colored in A on the bubble sheet. And when you're going back to check, you say, oh, what was I thinking, obviously. That's confidence. But if that is not the situation, do not change your answer, because the majority of the time you will change it to the wrong answer. And I had a student fail my course and have to repeat it, because on the first 2 exams, he changed enough answers. One time he changed 10 answers to the wrong answer at 1.5 points apiece. Big difference between a 65 and an 80 on an exam. So, you know, midway through the semester he learned his lesson, but it was too late because he dug himself into too big a hole. So be really, really careful. On an NCLEX question, once you hit submit, it's gone. You can't go back and change it. But before you hit submit, you could change it 1,000,000 times. So make sure that if you change that answer, change it with confidence, not with doubt. And the last strategy I'm going to tell you about is cover your answers. Now, this will resonate with some people, and other people will look at me like I have 2 heads and won't have a clue as to what I'm talking about. But there are some people who will start to read a question, and within the first couple of sentences of the question, they think they know where the question's going. And they're so afraid they're going to run out of time, and they want to just, you know, they're type A's, they want to be the first one finished or whatever. So they jump down to the answers before they finish reading the question. And one answer jumps out as being a really good answer. It's got all the buzzwords, you know, it's got all those things that you've had, you know, the Eddie's like drummed into you, you know, 1,000,000 times in a certain subject. So you go, oh, that's got to be the answer. But then you say, wait a minute, Pam told me to make sure I read the whole question. So you go back, but because you've seen all those answers and you've picked out what you think is the correct answer, you change the meaning of the question to fit the answer. Now, some people, like I said, are going to look at me like, never happened. Not a problem. People that have done that, you need to train yourself to read the whole question and not look at the answers until you've done that. So if you can't help yourself, take a piece of paper and cover your answers. If you're in a situation in the NCLEX where they give you a whiteboard, take the whiteboard and put it up there and cover the answers. And read every word of the question And then try to formulate in your mind what do you think might be the correct answer. And if you uncover the answers, there's probably going to be one that now is going to jump out at you as the correct answer because it's very similar to what you thought would be a good answer to that question. So don't let the answers morph the meaning of the question in your head. If that's a problem, don't do it anymore. So does anybody have any questions? Yes? No. No, it's either strictly your traditional multiple choice. It'll be select all that apply. They will also give you questions that are called, that have you put in order of priority. So, the steps of a particular procedure, or, you have a scenario and what is the first, second, third, fourth thing that you're going to do in order of priority. I give you a lot of those on my exams. Well, not a lot, but more than what people want to see. You will see those. You will see what they call hotspot questions, where they will ask you to move your cursor to a particular point on the picture to see, to show where the, where you would auscultate an apical heart rate, or where you would hear, a left lower lobe pneumonia, where on the EKG is, the ventricular response, or whatever, that kind of thing. And there's usually an area, like kind of a good, a surrounding area that you have that's, you don't have to like pinpoint it specifically. But they will do that. They will have you do math. And they will be very specific as to how they want you to round it or not round it. So be practicing your math. I'm a real sticker for math in 220. And make sure that you write it correctly. They used to mark it wrong if you didn't, like say you had something that was 0.5 milliliters and you didn't write it 0.5, which is the JCO standard for the proper writing of dosages, they would mark it wrong. I've heard recently they are not marking it wrong, but I will mark it wrong in 220 if you don't write it the proper way, because every facility that you go to is going to require you to do that as a JCO patient standard. You have a question? It's possible. Because if only one applies, then that's your all that apply. And that is not a trick question, because I've been accused of doing that. So, yes? Very similar. Yeah, ATI is good. I'm just going to stop the recording.